My name is Randy White, and I'm going to demonstrate the patient assessment for the EMT class. The first thing that you want to do is you want to make sure that you have body substance isolation on. So we'll say body substance isolation, and I'll put up my hands and you'll know that I technically have gloves on. The second thing that we want to do is we want to check and make sure that the scene is okay, that the scene is safe. And so we're going to look and see if the scene is safe. Do I see any dogs, cats, knives, guns, whatever around? Then the next thing that we're going to do is we're going to look at the mechanism of injury. Is there a ladder there? Did the patient possibly fall? Is, something around the scene there to give us any hints of what went on? The next thing that we're going to do is we're going to look and see how many patients that we have. Sometimes when you have rollovers and things like that, as far as motor vehicle crashes, patients can be thrown in all different directions. So it's a good idea to do a perimeter search and make sure that you only have this many amount of patients. The other thing is that we'll want to call additional ambulances if we have more patients, especially critical patients. The next thing we're going to look at is do we need any additional resources? In other words, do we need the electric company? There might be lines down. Do we need the gas company? There might be a scent of gas in the air. And then the last thing is I'm going to kind of look up and down to make sure that he doesn't need any C-spine precautions. In other words, am I going to have to hold his neck to make sure that he doesn't move? And of course, I would bring another partner in to make sure that that was being done while I did the examination. Now I'm going to approach the patient, but before I even get to the patient, I'm going to make a general impression. And what my general impression is, and it's hard to teach, is sick or not sick, good or bad. And the reason that we look at that is I'm going to look and see the approximate age of my patient. I'm going to see the approximate build of my patient. I'm looking to see if there's any hemorrhaging that I need to stop immediately. I'm looking to see if he's breathing, if his breathing pattern is normal. I'm looking to see if his breathing is making any noises. And if those things are present, then I have to immediately act. But in this particular situation, he looks fine, so I'm going to go ahead and approach my patient. As I approach my patient, before I start talking to him, I want to make sure that I am over him so he doesn't move his neck just in case I have missed something and he's complaining of pain in his neck. So I'm going to introduce myself, and I want to use an informed consent. And what that means is I have to tell him who I am, I have to tell him what my title is, and I have to tell him basically who I work for. Now you as students will say, I am, and then give your name, and I am an MTSU EMT student, and then ask for permission to treat. Hi, my name is Randy White. I'm a paramedic with Rutherford County EMS. Can I help you?
Yes.
Once I gain that consent, I'm going to immediately put my hand on his shoulder and one right here. I put my hand on his shoulder just because it's a lot more comforting and I can control him just in case he's combative or something like that. The next thing I'm going to do is I'm going to take his radial pulse. Okay? Now what I'm looking for is I'm looking for my ABCs. He's already spoken to me, so I know his airway is open. I know he's breathing because he wouldn't be able to say any words if he wasn't moving air in and out. And now I know that he's got a good radial pulse. I'm not trying to count his pulse right now. All I'm trying to do is just feel that there's a pulse there. Is it fast? Is it slow? Is it regular? Is it irregular? The other thing that I can look at is, of course, his skin color. And I can look at his skin temperature, and I can also feel if his skin is moist or dry or something else. And those are all good patient assessment techniques. Once I establish that rapport and that contact, then I want to ask one of 3 or 4 questions. The first thing I'm going to ask is, what happened? What happened to you?
I was running and fell.
Okay, so I've established now, then the reason that I asked that the first is because I've established now that he is basically, nothing has happened like a gunshot or he's been stabbed or anything that I would have to have any more resources. Where are you hurting at?
My ankle.
Which ankle is it?
On my left ankle.
All right. Now, once he says his primary complaint, the response to injury is pain. And so if he's hurting in his left ankle, I'm going to actually look at his left ankle, and what I'm looking at basically is to make sure that there's no bleeding or anything like that around, okay? And it also acknowledges his primary complaint. The next thing I'm going to ask is his name, and I'm going to continue to use his name throughout the entire scenario. So what's your name?
Scott.
Scott. All right, Scott, is that the only place that you're hurting?
Yes.
Okay. Scott, I'm going to put my hand on the back of your neck right here. I know your ankle is hurting, but I want to check and make sure that you're not hurting somewhere else. So I am going to put my hand right here, and I'm going to feel your neck. Does any of that hurt?
No.
Okay. I want you to take and wiggle your fingers for me. Atta baby. Okay, now let's wiggle your toes, Scott. That's great. And what I'm establishing is, that he definitely has no cervical pain and that he is not paralyzed because he's moving his hands and he's moving his toes. Now, once I establish that, and I might ask some other questions too, for instance, did you get knocked out? Are you sure there's nothing else hurting? Once I establish those things, now I'm going to move to his primary complaint. All right, Scott, this is what I'm going to do. I'm going to take a look at your ankle, okay? All right. So, not hurting anywhere else?
No.
All right. I'm going to ask you some kind of crazy questions, okay? But I need to know that you know where you are, that type of thing. Okay, Scott?
Okay.
Okay. Do you know who the president is?
Obama.
Very good. All right. What is today's date?
The 14th.
Okay, that's good. Scott, I'm going to just cut up your pants leg here just to make sure, and I'm going to take your boot off, and I'm going to remove your sock, all right?
Okay.
What we need to do there is we need to make sure that we expose the injury. And the reason that we need to make sure we expose the injury is basically because if I see a hematoma or if I see something in his ankle, I want to lighten up my touch a little bit because I don't want to cause him any more pain. So I'm going to start high up at the knee. All right, Scott, sometimes you hurt your knee when you fall and you don't even know it because your ankle hurts so bad. Does that hurt?
No.
All right, I'm going to move my way distally, and once I lose sight of my hands, I'm going to pick them up and I'm going to make sure that there's no blood on them. Okay? Now I'm going to see that there's a hematoma on his ankle, and I'm going to lighten up my touch.
Right there.
Okay, and it hurts right there, and that's where the hematoma is. Now I'm going to bring my hands down and complete my assessment on his entire foot. And now I'm going to check his pedal pulse. And then I'm going to say, all right, Scott, can you wiggle your toes for me? Good. And can you feel this?
Yes.
Okay, excellent. Well, Scott, this is what I'm going to do. I'm going to have my partner put on a splint to make sure that we get this splinted up and it doesn't move on us, okay?
Okay.
Okay. Now, what we're doing is we're checking for pulses, motor, and sensory distal to the injury. All right? Once I finish that, then I'm going to go back up and I'm going to examine him further. So, Scott, are you sure you're not hurting anywhere else?
I'm pretty sure.
Okay. Well, I'll tell you what. This is what I'm going to do. I'm going to give you an exam just to make sure that that you didn't hit anything on the way down or that kind of thing. All right. All right. Now we go into the detailed exam. We're going to do a head to toe, or we're going to do what can kill them the most to what can kill them the least. Okay. So I'm going to make sure I get the top of Scott's head. I'm going to make sure I get the back. Okay. His forehead, his eyes. Make sure that you get the orbit and the nose. Okay. I'm going to take a pen light and I'm going to look in his eyes to make sure his pupils are equal. I'm going to move to his ears and I want to make sure there's no fluid in his ears and no bruising behind them. Now I'm going to move down his jaw. Okay. Scott, can you bite down for me? Does any of that hurt?
No.
Okay. Open your mouth for me. Stick out your tongue. Excellent. Okay. Now I'm going to move to his chin. And now I'm going to move to his neck. I'm looking for midline trachea. I'm looking for jugular vein distension. And I'm also going to check a carotid pulse, one at a time, on his neck. Now, once I finish there, I'm going to go to the back of his neck, make sure that's still not hurting. And now I'm going to move around. We want to do this like water flows. And the other reason I move around is because while I'm examining Scott, I'm going to be looking at his face. A lot of times people will grimace under pain. And so I want to make sure that I see that. I'm going to move his shoulders as far back as I can get to his scapulas. Come around to them. Now come around his clavicles. And you see my hands are spread out. And I'm putting the same amount of pressure on my fingers as I am my palms. I'm going to come around to this chest. Now I'm going to ask Scott to take a deep breath for me. And in out. And what I'm looking for is his chest expansion. One more time. Excellent. Now I'm going to take a stethoscope and I'm going to listen here, 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 and here for breath sounds. Now I'm going to go to his abdomen. Now I'm going to roll on his abdomen and I'm going to check all 4 quads of his abdomen. Okay, any of that hurt, Scott?
No.
Okay. Now I'm going to roll back and get his kidneys back here in the back and as far as I can reach. Now I'm going to move to his pelvis. I'm going to push down just a little bit and squeeze just a little bit. Any pain there?
No.
All right, now I'm going to move to his legs. Broken legs can lose a lot of blood, so I want to make sure I get them well. Again, I lose sight of my hands. I check for blood. Now we have him splinted from here down, so I'm going to make sure that I come back and recheck my pulses, my motor, and my sensory. He's got good pulses. Can you wiggle your finger? Wiggle your toes for me?
Yes.
Thank you. Now can you feel this?
Mm-hmm.
Good. Now I'm going to move around my patient, and I'm going to check this side. I don't want to reach over my patient. Now, this hurt, Scott?
No.
He's got good pulses. Can you wiggle your toes? Can you feel this?
Yes.
Very good. Now I'm going to work on this arm while I'm on this side. Come all the way down. None of this hurts, Scott?
No.
I'm going to check a pulse just to make sure it's there. Wiggle your fingers for me. There you go. Now squeeze my hand. Excellent. Can you feel this?
Mm-hmm.
Now I'm going to check for capillary refill. Okay. Range of motion. Any of that hurt?
No.
Okay. Now I'm going to make my way around to the other side. Again, I don't want to reach over my patient. I'm going to start up here where I've already gotten. Any of that hurt, Scott?
No.
Can you bend your elbow? Very good. Again, checking for a pulse. Finishing out on the hands. Can you squeeze? Good. Can you wiggle? You feel this? And again, checking for capillary refill. Any of that hurt?
No.
Okay, excellent. Now, had he been spinally immobilized, we would roll him back and forth. But since it is only an ankle, I can go ahead and sit Scott up. Go. There you go. All right, now I want to check Scott's back. All right, Scott, just tell me if any of this hurts. I'm going to move my hand all the way down his back. Any of that hurt, Scott?
No.
Okay. All right. The next thing I'm going to do is I'm going to ask him the sample questions. Okay. We already pretty much know where he's hurting, so we don't need to know the site. But as far as the ample goes, we need to finish those out. So, Scott, are you allergic to any medications?
Not that I'm aware of.
Okay. Are you taking any medications?
No.
Okay. Do you have any past medical history I need to know about? Like heart, lung, kidney disease, diabetes, broken ankles, anything like that?
No.
Okay. Then the next thing I want to ask is, when was the last time you had anything to eat or drink?
This morning.
Okay. What did you have?
Eggs and bacon.
Cool. Okay. So then the last thing is the events. And so, Scott, tell me what happened to make you trip.
I was running away from a dog and tripped or stepped in a hole or something.
Must have scared the dog off, though, right?
Yeah, the dog's gone.
All right, good. All right, so, well, I'll tell you what. I'm going to take your vital signs, and then I'm going to get you loaded up, and we're going to go to the hospital, okay?
Right.
Okay, how old are you, Scott?
40.
Okay. All right. Well, I'm going to take his vital signs. I'm going to take his blood pressure, his pulse, and his respirations, and that'll be in another video. And then we're going to load him on the cot, and we're going to take him to the hospital.